Hello, my name is Rachel Callahan, and I am a student at St. Martin's University, and this is my postpartum assessment video. So, before I get started, I'm going to name off the vital signs. So, normal heart rate is going to be 60 to 100, and that'll be checked apically for 1 minute. Respiratory rate is going to be 12 to 20. Again, checked for 1 minute. Temperature is going to be 98.6 to 100.3. And blood pressure is going to be the same as it would have been during first trimester, so 120 over 80 approximately. I'm also going to be checking skin signs throughout, and during that time period I'm going to be checking temperature, moisture, color, whether or not they're diaphoretic, so checking for diaphoresis in general, and also I would check skin trigger. Alright, so I'm going to begin the assessment now.
Yeah, come in.
Oh, hey, Jean. Hello, my name is Rachel.
Hi.
I'm a student nurse. I'm here to do a postpartum assessment on you and make sure that you are all safe and everything's progressing well.
Okay.
So, first thing I do is I provide privacy, and I'm also doing a safety check. I see that you left your shoes in a place where you could potentially trip. I'm going to move these for you into a better area.
Oh, okay. Thank you. Sorry about that.
No, of course. Okay, so scene is safe. All right. So I'm putting on gloves. How are you? How was your birthing experience?
It was so exhausting.
Yeah?
I mean, it's my first one. I don't know if it was like normal or not, but
I'm
painful, but most definitely needed that epidural.
And I can see that you and your infant seem to be bonding well.
Mm-hmm.
Yeah.
Yeah, it's been a really amazing experience.
So,
my baby.
Wonderful. Awesome. And then how has your partner been? How have you been doing your work? No, I'm just kidding.
I mean, he's been amazing. He just been holding in between, and it's been hard to let him though because I want to hold all the time.
So. Well, that's awesome. I'm glad that you're doing a great job. In fact, do you mind if I give the baby to your partner while I do the assessment?
Okay.
Okay. All right. Hi. Oh, aren't you the cutest little thing? Okay. Here you go. Thank you. Alrighty. First thing I'm going to be assessing is your breasts. How have you been having any trouble breastfeeding recently?
No, I don't think so.
Do you mind if I expose one and
yeah,
visualize
sure.
well?
Is it normal for cracking?
So I'm gonna expose one. I'm gonna be using the back of my hand, doing an actual assessment. Is it normal for cracking? No, cracking is not normal. I'm gonna check the other side while I'm doing this. Cracking generally has to do with the latching problem. So the next time that you breastfeed, please let us know so that we can help you with that. Most of the time, women will they'll be holding their breast too far out and doing a pinching motion instead of holding the whole thing.
Oh.
And that makes it hard for the baby to latch. And when the baby is latching, you want them to have a super open mouth and then the nipple all the way in. So
okay.
Yeah.
All right, that makes sense. Yeah, I'll try that for next time. Thank you.
Also, you can do some drying. You want to make sure that it is. You can wipe it down with some water afterwards. Let it completely dry before covering it back up. And then if it's cracking, you can use a little bit of your own breast milk.
Really?
Mm-hmm.
Okay.
And make sure that that'll help it stay moist. So I'm looking for nipple trauma, and I'm also assessing for have you had golden stuff coming out?
Yeah, I've been kind of wondering if that's like the milk.
Colostrum, yeah, no, it's actually very nutritious for the baby, so it's good that that's coming. Okay, and then I felt for fullness and Okay, moving on to the next thing. The next thing that I'm going to be checking is your uterus. Do you mind if I uncover your abdomen?
Oh, yeah, sure.
A bit, thank you. Okay, so I'm going to be feeling. And how long ago did you have your baby?
I had him 10 hours ago.
Okay, so I could feel right here. Do you mind if I have one of your hands?
Yeah, sure.
Okay, so this is the top of what's called your fundus. So that's the top of your uterus.
Oh,
and you can feel how it's right above your belly button right now.
Mm-hmm.
Tomorrow, it's literally it should be about 1 finger underneath, which is about 1 centimeter.
Okay.
2 days from now, 2 fingers,
Oh.
and so on and so forth. Around day 9 to 14, you shouldn't feel it anymore. Okay? And we want it to be nice and hard so that it prevents bleeding. And then also if it's not midline, so if, for example, if it's off to the right, and it would also be squishy at that point, then that could be an indication that your bladder is full and you need to pee. And then we also might need to do a fundal massage, because if it's soft, then that could increase bleeding.
Okay.
Okay. So next I'm going to move on to bladder. Do you mind if I feel really quick?
Yeah, sure.
Okay. So I'm going to be feeling. When was the last time that you urinated?
Like an hour ago.
Okay. And has it been so when you are urinating, or if you have a Foley catheter, you want it to be at least 30 cc's per hour, and you can tell by peeing in a hat.
Yeah.
What has the color been?
The color has been yellow.
Okay, so normal.
Yeah.
Okay. And then while I'm here, I'm also going to auscultate bowel sounds. If you had a C-section. I'm also going to so for patients who have a C-section, I'm going to be assessing the dressing. I'm going to make sure that it's clean, dry, and doesn't have any signs of infection. If it has any stains or drainage on it, I'm going to circle that and then put my name, date, and time on it, and then check it later to make sure that it hasn't gotten worse. I would lift up the dressing. I would inspect the incision. I would be looking for approximation of the edges. I would be looking at the steri strips, and I would be checking to make sure that there's no dehiscence or anything of that nature. And everything looks good. A little bit of distension and bruising is normal. Okay, so, and then the next thing that I would check is your bowels. When was the last time that you had a number 2?
It was before I left for the hospital, so at least 24 hours now.
Okay, so it's normal for for women who just gave birth to not have a bowel movement for 24 to 48 hours. That's normal. We will give you stool softener. The only thing we're worried about is you passing gas. Have you been able to do that?
I think once.
Sweet. All right, so the next thing that I'm going to be checking is what's called lochia. And
What's that?
That's the discharge that comes out of your vagina after birth.
Okay.
Okay, so I'm going to have to visualize. Is that okay?
Yeah.
All right.
Of course.
So technically during this time, I'm also going to be checking the perineal area.
Okay.
Because may as well get both of those out of the way. Okay.
Are you talking about just like my groin area?
Mm-hmm.
Oh.
Would you mind kind of just spreading the legs a bit more so that I can visualize? Perfect. Thank you. Okay, so I'm only seeing a little bit of drainage on the pad. When was the last time that you changed it?
It was about like 2 hours ago.
Okay. Perfect. And if you notice that the pad gets saturated with that bright red blood in less than an hour, that is a concern, so definitely contact us. Okay. So it's going to be normal for you to have red discharge for approximately 3 days. And it's going to be that bright red. Blood clot should not be bigger than a golf ball. And there's no. And then there shouldn't be an odor. If there's an odor, that is concerning.
Okay.
And then, that we've already talked about the amount. It'll progress into more of a yellowish, pinkish color, and then eventually it'll just be this golden color. At the end, that'll be about 6 weeks from now, at which point you will have a day or two of spotting bright red, and that's the last little bit of the uterus coming out.
Okay.
Okay, and now while I'm down here, I'm also checking for your perineal area. I'm looking for episiotomies and lacerations. And with that, I'm going to be checking what's called RETA, which is red. I'm going to be checking for redness, ecchymosis, which is bruising, edema.
What is edema?
Edema is swelling.
Oh, okay.
And then I'm going to be checking for discharge, which we just did the Lucia. And I'm also going to be checking for approximation if you had, like I said, the episiotomy or the laceration, making sure that those edges are still connected. All right, everything looks good over here. Do you mind if I have you turn away from me so that I can, because I'm going to be looking at your anus to make sure that you don't have any hemorrhoids.
Yeah, sure.
Okay, so just grab the edge of the bed. Perfect. And roll. Okay, using the back of my hand, I'm just going to lift up, checking for hemorrhoids and making sure that everything else is good. Everything looks good. Okay, you can go ahead and lie back.
Did you see any?
I didn't see any hemorrhoids.
Oh, okay.
Did you have a long birth?
Yeah, I think so. I mean, I think it was like 12 hours. Is that right?
Okay. Well, yeah, that's actually really short for a first birth.
Oh, really?
Oh,
okay.
yeah. No, you're very lucky.
To be honest, I didn't do so much research as I should have as a pregnant person. But...
Oh, you're fine. I'm going to be checking your legs now.
What are you checking for?
I'm going to be checking for redness and tenderness.
Okay.
Do you feel any?
Mm-mm.
Okay. And then I'm going to be doing a clonus. Do you have any pain on the back of your calves?
Mm-mm.
Okay. So everything looks good. What we're looking for here is a DVT, which is a deep vein thrombosis, which is pretty much a clot. So I'll talk more about that in a little bit, but your lower extremities look good. I'm also going to be feeling for pedal pulses, which are equal and present. And then I'll also check cap refill while I'm down here. Sweet, everything looks good. All right, and then while I'm up here, I'm going to also be checking cap refill. And then I'm going to check for skin turgor, which would indicate dehydration. And then I've already gone over C-section. Okay, so now I'm going to be giving you a little bit of postpartum care. I'm going to go through this really quick because I'm going to be giving you a pamphlet.
Okay. I actually have a question.
What's your question?
I've been sweating a lot. Is that normal?
Yeah, no, that's called diaphoresis,
okay.
Which is excessive sweating.
Okay.
And that occurs naturally because your body's trying to get rid of all the fluids that you accumulated during pregnancy. And so they come out through your pores and you sweat a lot. So that is normal. Thank you for asking. You'll be concerned though if you start to have any of these other changes that I'm about to tell you about.
Oh, okay.
Okay, so I am going to give you a pamphlet for this, so this is going to be really fast, okay? So we're going to use an acronym called post-birth. Anything of the first four that I'm going to tell you are going to be emergencies. Call 911, okay? So first one is going to be pain in the chest. The second one is going to be obstruction of breathing or shortness of breath, seizures, and then also if you feel like you're going to threaten yourself or your baby. All of those are emergencies. Call 911, okay?
And threaten, are you meaning like suicide? Or?
Yeah, if you're thinking suicide or homicide of your child, that's
okay. Yeah.
Those are emergencies, obviously. Sure. Okay, and then the rest of these are all going to be call your doctor because it's important, but it's not an emergency yet, unless they tell you. So first one's going to be bleeding, so more than one pad per hour. Second one is going to be incision. So if your incisions come apart or if there's signs of a major infection, that's an emergency.
And signs of infection would be what exactly would I be looking for?
You'd be feeling for heat. Like I said, the edges would come apart. They'd be discharged. They'd potentially be bleeding. If one of your incisions breaks.
Okay.
And if there's major hemorrhaging, so bleeding. Okay. All right, and then next is going to be redness and swelling, which I was telling you about down here for the DVT.
Mm-hmm.
That is an emergency, or that's you need to call your doctor about that. Other than that, there's also going to be temperature. So if you are above 100.4 degrees Fahrenheit, that's a temperature that. And then headaches that are not relieved with Tylenol or vision changes. Like I said, I have a pamphlet for you. So,
Okay.
Is there anything else that you were wondering about as far as discharge process or anything you feel I didn't cover properly?
How do I know if like my baby's hungry?
Okay. So, crying is actually the latest sign, and we want to keep baby from getting there. Okay? So if you notice that the baby starts to become like seen agitated, they start to open their mouth and it actually looks like they're looking for a nipple.
Mm-hmm.
If they start suckling on their own fingers, sometimes that could be an indicator.
Okay.
They'll start to make noises, and then last they'll start to cry.
Okay.
So
thank you.
The moment that you notice that they're starting to get restless, it's possible that they're hungry.
Okay.
Okay.
All right. Thank you so much for that information.
Yeah, of course. Okay. And thank you very much. I'm gonna go and do some documentation now, and I hope you have a lovely day with you and your lovely baby.
Okay. Thank you, Rachel.
Yeah, of course. Thank you, Olivia.